Hi, I'm Dr. Sherry, Chief Medical Officer of Women's Health at QuickMD. Today, we're talking about something many women have questions about, but don't always get clear answers on, and that's oral estradiol. What it is, how it works, who it helps, and how to use it safely. Estradiol tablets are one of the most common and well-studied forms of systemic estrogen therapy. They've been used for decades, and for many women, they offer steady, reliable relief from those disruptive symptoms of perimenopause and menopause. My goal today is to help you understand what these tablets do, how they work in your body, and how to know whether they might be a good fit for you. So let's get started. Estradiol is the main form of estrogen your ovaries produce during your reproductive years. So when your estrogen levels decline during perimenopause and menopause, your body feels it. Hot flashes, night sweats, mood changes, brain fog, sleep disturbances, hair loss, dry skin, dry vagina, weight gain, bloating, joint and muscle pain, frozen shoulder, and other metabolic symptoms. Sound familiar? Oral estradiol tablets give your body back a bioidentical form of estrogen. Bioidentical simply means the hormone has the same structure as the estrogen your body naturally makes. When you take estradiol by mouth, it travels through your digestive system and then it passes through the liver before entering your bloodstream. This process is called first-pass metabolism. It is why oral estrogen behaves a little differently in the body compared to estrogen you absorb through your skin when using the estradiol patch. Your liver helps break down the estradiol and modifies this hormone before your body circulates it, which can slightly affect cholesterol, clotting factors, and inflammation. For some women, this is completely safe and well tolerated, but for others, especially those with certain medical conditions, a patch or gel may be a better option. A common question I hear is whether oral estrogen is dangerous. Well, this is a myth. Oral estrogen is not dangerous when prescribed to low-risk women. Like any medication, it has risks and benefits. For many women, it is a safe and effective way to restore estrogen levels lost and reduce the disruptive symptoms of perimenopause and menopause. Understanding your health profile is what helps determine the safest choice of hormone therapy. Now let's talk about what benefits estradiol tablets can offer you. Estradiol tablets can offer significant relief from many of the disruptive symptoms that show up during perimenopause and menopause. They help with hot flashes, night sweat, sleep disruption, vaginal dryness, brain fog, mood swings, and other bothersome symptoms of menopause. Many women tell me they feel like themselves again and they are not struggling to get out of bed, go to work, or happily deal with their kids or partner again. And as a reminder, hormone therapy will not replace diet or healthy lifestyle changes, but they do help stabilize these hormonal shifts and do make your efforts feel so much better. Taking an estradiol tablet is simple. You swallow the pill once a day around the same time. Consistency helps keep your hormone levels steady. Most doctors will start you at a lower dose, ideally 0.5 milligrams, then adjust based on how your symptoms improve and how your body responds. We do not need to check estrogen blood levels to know you are on the correct dose. Your symptoms will help guide us to know if you are on the correct dose of estrogen. A common mistake is thinking that more estrogen is better, but it's not. The goal is to find the lowest effective dose that gives you relief from the disruptive and bothersome symptoms of perimenopause and menopause. Another question I often hear is whether it is okay to switch from patches to pills, and the answer is yes, you can. Some women prefer the convenience of a daily pill, while others prefer the steady absorption of the estradiol patch. Switching is fine, but you should always be guided by your healthcare provider so your dosing stays consistent. Now, if you still have a uterus, you will also need progesterone. Progesterone protects the lining of the uterus from becoming too thick, which can lead to bleeding, precancer, and cancer of the uterus. But if you do not have a uterus, you do not need to take progesterone with estrogen therapy. Let's discuss some of the risks. Oral estrogen can slightly increase the risk of blood clots and stroke compared to the estradiol patch. For many women, especially those who are younger, physically active, non-smokers, this risk is very low. But it's an important factor when choosing the right estrogen therapy. Women often ask whether oral estradiol is safe if you have migraines. It depends on the type of migraine. Migraines without aura are usually compatible with oral estrogen. Migraines with aura may be better suited to be transdermal form of estrogen like the patch or gel. There are medical conditions where oral estrogen should be avoided. Those women with a history of blood clots or clotting disorder, uncontrolled high blood pressure, certain estrogen-sensitive cancers. Now, if any of these apply to you, your doctor can help you choose a safe alternative. When starting the estradiol tablets, you will typically experience normal side effects for the first couple months, including breast tenderness, vaginal bleeding, and bloating. Always follow up with your healthcare provider if you notice new breast changes, persistent bleeding, severe headaches, leg swelling, shortness of breath, or chest discomfort. These symptoms are very uncommon but should always be evaluated quickly. Seek care if you experience severe headaches, leg swelling, chest pain, shortness of breath, or unusual bleeding. These symptoms are very uncommon but should always be evaluated. Estradiol tablets are a highly effective and well-established form of systemic estrogen therapy. They offer strong symptom relief for hot flashes, sleep disturbances, mood changes, and other bothersome symptoms of perimenopause and menopause. They also support bone, brain, cardiovascular, and metabolic health. And for many women, they provide a simple and reliable way to restore estrogen. If you are using oral estradiol or thinking about starting it, I hope this helped you understand your options more clearly. Thank you for spending time with me today, and I look forward to seeing you in our next session.